this is the brick and mortar where everybody wants to go. You know that, right?
I mean, I take great pride in that.
Man, this is harder to get into than the Oscars and the Roots picnic in Philly. Okay, so today we are taking it from the clinic to the carpet. I'm here with the man, my guy, everyone's guy, Dr. Jason Diamond.
Thanks for that. Appreciate it.
So tell me about lip service. I mean, we're here to talk about, I'm here to know more about lips. And one thing I love about the collection of everything that you've done in the skincare, it's all based off of a procedure or it kind of is emulated after something you do in clinic.
Yeah, that's absolutely right. When we started, you know, it all started basically with the Instafacial, which is one of our very popular treatments. It's a skincare protocol that I developed over years and years of having experience with bioregenerative treatments, which I was doing in surgery. For years, I was doing it only in surgery, taking people's stem cells from their fat and things like that. And then over years and years, we realized I could do this in the office. I don't need people asleep for it. That's how the Instafacial was born. And based on that, years and years of using the Instafacial, which again is mainly a bioregenerative type of treatment, meaning your body learns to heal. We show the body how to kind of repair itself. It was based on that experience and knowledge that we said, you know what, now we know how to put this in a product. And so it all started with the Instafacial. And from there, we said, you know, we have so many treatments that we have that are proprietary to me, or that I have that were out there for years that I have perfected over years. And so so every product we have is inspired by something I do in the office.
What I'm thinking about from this entry point, which is the one that I love, is this the red plasma?
The plasma is part of the Instafacial.
Okay. I knew it. Yes. It repairs. It's also really good post shave, I feel.
Totally. Yeah, absolutely.
So I'm curious, what's the newest addition to the block? Like, you know, the new kid on the block that you're loving right now for summer is going to be what? Lip.
We just launched the LipLift, which is incredible. People are raving about that. As am I.
Take me through there.
So the LipLift again. So similar to the Instafacial. So eyes are a very common area that people complain of, and one of the first
signs of age.
And I take care of all age. I mean, I take care of 15-year-olds for their nose. I take care of 75-year-olds for their face, aging faces and everything in between. But one of the first things that younger people in their late 20s, early 30s start to see is their eyes. People tend to see the aging in their eyes. Lower, typically, before they see like anything else. When people hit 50, they'll complain about their neck and jawline. But at 30, 40, almost everyone's complained to some degree about their eyes. So based on that, I've seen every single problem that the eye can have. Hollowness, puffiness, dark circles, pigment problems, crepey skin. And we figured out surgical and non-surgical ways to deal with any problem that there is. So again, based on that experience, based on my knowledge of what happens with the eye, we said, you know, and based on my experience, my knowledge with bioregenerative treatments such as growth factors and peptides and proteins and stem cells and all that type of thing, we said, okay, we can come up with a product that addresses all these concerns. And so we came up with what's called LipLift, and it's designed to address concerns both for the upper and lower eyelid.
Upper as well.
Upper as well. I think it's the only one I know of that's
I've never heard of an eye cream that
either have I. So that we launched that a few months ago. It's amazing. People love it. And similar to LipLift, we are launching LipLift very shortly. And LipLift is based on the same issue, based on the way the mouth and lip age, which can be really, really noticeable for many people. There are a million different ways the mouth can age, and there are so many things that people complain of with that. People will complain of with lips. People will complain of the smoker's lines, even though they don't smoke. Most people don't smoke these days, but still everyone says, Doc, I got the smoker's line. So it's crazy.
We live in California. People smoke. They have herbal refreshments.
Fine, but it's not the typical, cigarette problem. But nonetheless, they're called smoker's lines, which are very distressing for most people because that just shows age. Those vertical lines, okay? People's lips get thinner with age. They lose volume, they lose collagen, they lose their natural fat, which thins them out, and that portrays a less attractive look. The distance between the nose and lip elongates.
What's that about?
It's due to a lot of things. It's due to loss of bone. We lose bone around here, around the face, and that causes a sinking in, which causes a lengthening, as well as, again, loss of collagen, loss of elastin to the superficial skin. Things just start to get long and thin. So like a youthful mouth, when
Yeah.
a youthful mouth is slightly open,
Okay.
you'll see the bottom half of the upper teeth or a little portion of the upper teeth.
Wow.
As we get older, we lose that, okay? And that looks old.
So babies, they have a short distance here.
As a matter of fact, the baby's lip is like it's like sort of like the gold standard of what a
Wow.
beautiful lip should look like, right?
Yeah.
That nice perky pink with that where you can see the
Yeah.
if they had teeth, you'd be able to see the teeth, right? That short distance, right? That strong Cupid's bow, yes. And so,
In office, doc, can we go back in time to take this up, or is that even a thing?
wait, it is a thing. That's a lip lift. That's a surgical lip lift,
Okay.
and it works beautifully for the right person. As a matter of fact, it's a very common thing that I do with facelifts for women. I do it on probably 80% of my facelifts. However, it's great for guys too, because guys get that long thin upper lip. That looks old too. It's great for guys. I think dealing with the lips for guys is an underrated procedure. I think it's a very underrated procedure.
That's true.
Full lips look great on guys. It's youthful, it's sexy, it's vibrant, right? And it's sexy in a masculine way. Like the best looking guys have nice plump full lips. No one had thin pencil lips doesn't look good on a guy either.
That's true.
And so when you can reestablish that, that's a great procedure for guys too.
We try to illustrate or emulate some of the things that you do. I mean, mind you, there's no bippity boppity boop. I have that. It's permanent. But, we try to make sure that we create at least a shorter distance and more of that three-dimensional quality to the lips.
Yeah.
But for guys, we don't have it as much. I feel like we have mustaches. We have a little bit of hair we can use to sort of give us a faux simulation. But I also feel that people seem believable. I believe people who have fuller lips. Is that a thing?
It very well may be. I've never heard that people with fuller lips are more believable. I never, but I would believe it. But there's a lot of beauty, there's a lot of attractiveness that resides in the lip for men and women. There's a lot of attractiveness that resides in the lip area. They always say the eyes are the, where you can see somebody's soul, the window soul, but the mouth is where it's all expressed. So all your personality, it comes from the mouth, right? Like for like a majority of it. And so, yeah, it's a very important part of the face for attractiveness, and it ages fairly quickly. And when it happens, it's a dramatic change. It can really change the face. And so there are both surgical and non-surgical ways to address every single problem. I figured out over 25 years, every problem the lip can have and every possible which way we can fix it. And so based on that knowledge, we decided to create LipLift. Again, using my knowledge of bioregenerative techniques and strategies and combining the years and years of experience with all the different techniques I have to fix the problems. And we knew we'd be able to encapsulate that in a product. And so we came out with LipLift, and it's awesome. So let's talk about the anatomy of the lip.
Okay, cool. I need to know. I don't have a pen to take notes, but okay, we're gonna run this back.
So it's not just, obviously everyone thinks the lips, the pink part, right?
For sure.
It really starts at like the bony area we call the premaxilla, the bone here, because this all kind of supports the lip. And people talk, you always hear about osteoporosis of the legs. Everyone talks about osteoporosis of the face, but losing bone to your face is one of the major contributors to facial aging. So as the face resorbs and loses bony volume, well, this area called the premaxilla loses bony volume too. And what happens when this sinks in? It's gonna create like a caving in of the upper lip. So the upper lip starts at the bone, really, it starts at the bone beneath it, okay? Now, of course, you've got skin from here to here, but under the skin is a muscle layer. And within the skin is a fatty layer, the subcutaneous fat.
Okay.
Right? There's not that much subcutaneous fat or fat beneath the skin on the face, but there's some.
Okay.
As we get older, we lose some, not only is the bone cave in, but we lose some of that fat. That's where you start to see those vertical lines.
Okay. Around the border?
Well, there's fat under the skin. And so when you see those kind of wrinkled up lips with the vertical lines, that's because we've lost fat now, the fat camouflage between the skin and the muscle. So under the skin, there's muscle.
Okay.
The lip it's a big circular muscle called
this. Know that?
Yes.
Can we work them out?
You cannot work them out. They do not work that way. So the mouth, same as the eyes. These are circular muscles called sphincter muscles. So under the skin, there's a little fat, then there's the muscle, okay? And that's how the whole mouth is made. Now, the pink lip in particular, right under the lip, again, there's a little bit of fat, and then there's muscle right behind the pink layer too. So those are the layers that are in the pink part of the lip. So it's skin, but the skin of the pink we call mucosa. It's the same tissue that's in the nose, same tissue that's in the mouth, same tissue that's in the rectum. It's that smooth, soft skin that's called mucosa. Okay, and so That's the superficial skin here. Under that is a little fatty layer, and underneath that is your muscle. And so those are the layers that are there. And as we get older, we lose some of all of it. It all sort of deflates.
One thing that I'm realizing or actually learning today, that there's a bioregeneration that runs parallel to everything that you do.
For sure.
So what does that mean to you or this place? I mean, when I say this place, I mean the fact that this is the brick and mortar where everybody wants to go. You know that, right?
I mean, I take great pride in that.
Man, this is harder to get into than the Oscars and the Roots picnic in Philly. So tell me about that.
Yeah, I take great pride in it. We love our practice, we love our patients, and and we take care of as many people as we can, and but as far as bioregeneration goes, that's become kind of a hotter topic over the past, I'd say, 5 years. You're really starting to hear people talk about things like stem cells, exosomes, PRP, PRF. These are common terms now, but I've been using these things for 25 years before anyone ever heard of them. And again,
Stem cells been around for that long?
yeah, so yes, they've been around that long. Now the stem cells that we use, we take them from people's fat.
Okay.
It's called nanofat, where we liposuction out a little bit of fat, or you take the fat however you can, and you convert. And when you convert it, there's a system to convert it, where we take out all the actual fat cells, but we're left with like the stem cell component of the fat, and that we use for many different things. It's awesome to put in the face, to put on the face, and basically what it's doing is it's signaling your own tissue to repair itself. Okay, that's what bioregeneration really is.
It's communicating.
It's communicating. It's telling the cells to produce collagen, produce elastin, to repair, to restore. Okay, we all have that ability, but as we get older, we lose it. So the classic example is if you take like a small, like a baby or a child, they heal so robustly. Infants don't even scar. You can like cut. They've shown you can like lacerate like a fetus, and it heals because there's so many healing capabilities. There's so many growth factors present. They heal with no scars. It's unheard of, but fetuses heal with no scars. And little kids heal so beautifully well because there's an abundance of healing factors. As we get older, we lose that, just the way all our organs start to fail. The heart starts to, right? You get older, things fail. Well, your bioregenerative properties of the body fail too, based on decreased protein production, so peptides, growth factors, they're all basically proteins. They're just complex proteins, and we lose our ability to produce proteins and growth factors as we get older. And so what these bioregenerative properties do is we are able to reintroduce some of those back into the body to kind of kickstart it, to say, oh yeah, I know how to do this, and boom, to start repairing and recycling, getting rid of old dead cells, stimulating production of new cells. And so that's really what bioregenerative treatments are. And it's becoming more and more and more popular as people realize how good it is, but it's something we've been doing for 25 years.
So it's like a new engine in a box Chevy or something like that.
Yeah, essentially. That's a good way to think about it. So I have a couple questions for you, being that you're at the top of the field in what you do as well. Lips come in all different shapes and sizes, right? And people, for me, they ask me to harmonize. They want to look their best. So I'm always trying to balance the lip with the other parts of the facial features. I never want it too big. I don't want it too small. I want it just right. How do you do that? Because I've seen, it's like you work magic with your strategy as well. Well, how do you deal with that?
Well, Dr. Diamond, I was always thinking about lights and shadows. So for me, lights and shadows, I look at volume. Where can I create the most volume with light? Where can I actually allow the light to recede? So that's what contouring or sculpting, if you will. We want to make sure that you're not taking someone completely far away from where they were. And also, as a woman, you don't want to masculinize her face. Is that, make them too masculine? And also with guys, you don't want to make them too feminine. So I think that there's a nice sort of genderless quality in the middle that we all kind of know and love. And it registers to the eye immediately. So I would say lights and shadows.
Lights and shadows.
Lights and shadows are important.
And do you feel like it's important for guys to have the right proportions? Don't you? Do you do that for guys too?
Yeah, listen, even for myself.
A
bit. But we want a strong jaw. We want, some density in the brows. I feel like with guys, if we start to lose our brows, because our brows wane as we get older or as we become more mature, I like to say older. I'm pro-age. I'm pro-age. And so when we think about losing, some of that hair, how can we bring some of that back? So can we tint our brows? Can we microblade them? I think when you look at a guy and he happens to have none of that, it doesn't necessarily register as supremely masculine
Yeah.
in a Western sense. A lot of this has to do, and I'm not sure if you agree, but it does have, it's cultural as well.
I agree 100%. It definitely with age, people lose their brows. And to me, when a guy loses his brow, that looks more egregious than when a woman loses her brow. It's really an important part of the face.
That's for sure. No one talks about it.
Yeah, no one talks about it. It's an important part of the face. But yeah, you're using light and making the light and shadows and making things recede, right? And so I'm trying to do the same thing where I'm augmenting to create like projections, and then behind the projection there'd be a receding, which kind of highlights the same things you're trying to.
I have to say, man, what you do is the blueprint on what we try to illustrate for concerts, for red carpets, for cover stories. So that's if they have it, and if they don't have it, we try to usher them into as much of a pullback as we can.
Yeah.
Within reason. Some people are unreasonable in their pursuit of, like, I think there's this whole conversation right now of doing things that are topical, but not underneath. Like, how do you say lower
Facelift?
lower facelifts? A lot of people are doing the quick version.
Yes,
It's not the most severe. Not severe. How would you understand? How would you describe that?
Yeah, you're talking about the most thorough, comprehensive approach. They're not doing the comprehensive correction.
Yeah.
They're the more superficial, like shortcut kind of thing.
They're doing
which is not as good.
drive-by.
Which is not as good. Right.
Not as good, man.
Right. It's not as good. When it comes to, we talked about the bony erosion of the premaxilla. When this caves in, everything falls. So one of the first things I'll do is I'll inject deep a product on either surgical, implant something to reestablish that weak bone, or inject down on the bone to reestablish that. And when that comes out, that has an incredible improvement to the actual lip itself. Okay. When it comes to the skin, the vertical wrinkles, and when we lose the fat, we lose some collagen elastin, we get that thin, wrinkly upper lip. The gold standard to correct that is actually a surgical lip lift. We're actually removing a significant portion of the damaged skin.
Wow.
There's no better way to deal with damaged skin than to remove whatever you can. It works better than anything else. So we remove it, and the consequence of that is actually making the lip, putting the lip in a better shape and rolling up and making it more attractive. So you're removing damaged skin and giving the actual pink lip a better position. Sometimes we'll use lasers to improve the skin quality
Of the inside lip.
we can do it on the inside lip, we can do it on the superficial skin that's getting those vertical creases. There are many ways to make that skin actually look better. Now, when it comes to actual volume of the lip, sometimes with the lip lift procedure, that rolls the red lip up and shows more red lip. You don't even have to put anything in it, and the lip looks more volumized. So people love that. But if we're actually trying to give more volume, which we do a lot, we'll inject a product. In the office, I'll inject a version of a hyaluronic acid because it's just the right consistency. And like you said, to take advantage of the light reflexes and the shadows, I'll line the vermilion border. That's the junction between the pink and the tan lip. And I'll line that and create like a nice sharper contour, which looks really nice. And sometimes we'll actually reestablish volume in the actual meat of the lip, and that just depends on the person. Something that most people don't know, the bottom lip should be 2/3 the size of the upper lip. So 1/3, 2/3. The lower lip should be thicker
both
than
men
the
and
lip.
women?
For both men and women. The lower lip, like on you, you're perfect. You're perfect. 1/3, 2/3. You are
from my dad.
You're the perfect
Thanks, man.
example of anatomy for the junction. Most people feel like the mistake you see is people say, oh, I just see my upper lip bigger, and they boom, 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 and then it's much bigger than the lower lip. That's unnatural, and that's out of balance. So I always take into account those things.
Is the bottom lip supposed to like pout or hang a bit more? Is that what I'm supposed to?
Yeah, the bottom lip's supposed to it's supposed to pat out just a little bit more than the upper lip, ideally, yeah.
Okay, I like this. I like this. You learn something new every day.
So these are the things I do. But let's say I've gotten somebody, I've done what I can for somebody, and they're ready to the red carpet, and you get them the day before the red carpet or the morning of the red carpet. What are you actually doing?
Back in the day, like I would say late 90s, early 2000s, we were all about blanking out the lip. It was all like the new lip era. I don't want to go through makeup because there's so many trends when it comes to lips. Every decade in the 20th century had its own lip shape. The Claire's bow, you look at the Marilyn, you look at the Marlene Dietrich, which was more of a, what is this area called?
The Cupid's bow. Philtral column. The philtral columns. Yeah.
Like Rihanna has a really strong philtral column?
Yes, philtral column.
And that also conveys a lot of femininity and fertility as well.
Yes.
What I would try to do more or less is create like shadows underneath the lips. So contouring and sculpting, I'll either take something brown or a liner and go not on the lip, but around to create density and darkness there, just so it can protrude. So before color ever happens, we're going into this three-dimensional quality that happens to give the ultimate like zhuzh, if you will. And then you can add color.
Makes perfect sense. It makes perfect sense.
For me as a guy, I just try to make sure my facial hair does that.
Yeah, but it's perfect, right? It does that. It does that. But it's important for guys.
And
It's so important.
no one
for
talks
guys.
about it.
No one talks about it because guys are afraid to look feminine, and a lot of guys don't want to look feminine and they want to look better. You can make a guy, you can keep the lip masculine and augment it in a masculine way, and then they look much better. It's really an underdone procedure.
Barbers are really good at this too. I would say, you know, as a makeup artist, yes, we look at what we can do with women, but I see so many men go to barber shops for some of the illusion, if you will, that you're creating on a permanent basis. Have you thought about that?
I haven't thought about that. I really haven't, but I can see how that's the case.
Yeah, they can shave off a jaw by creating the perfect beard.
Yeah, right. I have seen it. Right, they sculpted beard to make things look true. Yes, I have seen it. Yes, and they're good at it. Yes.
Okay, so
Yes.
one thing I'm just curious about, you actually told me about this last time I saw you, which is the vermilion border.
The vermilion border.
I remember when lips weren't as modern as they were now, when people were going and getting stuff done, and that was gone. So why is it now so important to see it when 15 years ago, it was like an illusion that left us?
You know, I don't know the answer to that. I've been in practice 25 years, and ever since I've been in practice, I've been trying to sharpen the vermilion border. And the reason is we want to see what we consider sharp aesthetic units.
Wow.
So like when my eyes are scanning your face, my brain is interpreting it's like if you were to put a scanner, it's going it's going to all these things, and it's focusing on individual features real quick. It's kind of piecing it all together. Yeah. What the brain likes to see is sharp anatomical units. It likes to see clear definition between parts. Right. And so when you have that sharp vermilion border, it's really identified like this sharp, where the mouth begins and the lip ends, and where the lip ends and the nose begins. Like the face likes to see these sharp definition of features. And so when you line that vermilion border, you're really clearly delineating, okay, lip stops here, okay, tan lip starts here, right? You don't want it just to blend in. It's kind of like, it's like with everything. You want to see where the eyes end and the cheek begins. You want to see where the nose ends and the lip begins. And a lot of people have that sharp distinction, but some people don't. Some people like it's
fish
really
lips. They call them fish lips.
Yeah, well, some people it's really hard to tell. Like, where does the nose end and the lip begin? It kind of all blend. You can't really see a sharp separation. And so you like to see these sharp separations in features. And so to me, when you recreate that vermilion border, you make that nice and sharp, it's like, okay, boom, there's the lip, and it just looks great. Wow. It just looks great.
So Doc, you and I are responsible, and also we share some clients, but we're responsible for some of the most beautiful women or people in the world. And so one thing I do know is that when they look good, they feel even better. I always say that beauty is a feeling. I feel like when you feel good, you emanate something different, and it's just contagious, you know? So that's my philosophy on beauty. But I also know that if their lip shape is different, isn't there some science to the fact that they're not recognizable in the same way?
Yeah. Studies show that like you could take the most famous face, if you like superimpose a different mouth or a different lip shape, that it can take like the celebrity face and turn into like not nearly as attractive or recognizable.
Lips are that powerful.
It's that powerful. It's that powerful. And my philosophy is you look your best to feel your best. You feel your best to do your best.
Do your best. I like that.
So that's been my philosophy ever since, and since I started. So I agree with you. We're totally locked step with that. So we're responsible for keeping these people looking maximized, right? And so dealing with the mouth is an essential part of that. And for me, it's a matter of maximizing or enhancing their natural beauty, but never changing their feature, right? It's about maximizing. And again, how do I do that? I do that through a series of, like you said, like taking advantage of the projections and to create those, the way the light reflexes off the face and the way people see it. And it sounds like you do the same thing. We're doing the same thing, just sort of in a different way.
I got one question, personal question.
Yeah.
I always want to know, do you look at people and decide what you want to do or what's already working?
Both. The main thing I do is when I look at a face, the first thing I want to do when I'm talking to somebody, I want to see, I always ask them to pull their hair back, because I just want to see their face move. I want to see how it all relates to each other. And then very quickly, I understand where we need to focus our attention to maximize a good feature, call attention to a good feature, and sort of distract from maybe a not so good feature.
Gotcha.
Oftentimes we're trying to improve not so good features too, but really if we can enhance the best features and call attention to that, that's like the best way. That's the best way to make somebody look their best and keep them looking like themselves.
And also keep them happy.
And keep them happy, because people love that. Yeah, yeah.
So back into this lip service idea, I tried this. First of all, the packaging is pretty damn good.
Yeah,
I love the packaging.
Thank you.
And also, I love the fact that it's not oily. So using this under lipstick did not change the texture of the lipstick.
Awesome.
It didn't change the texture of a gloss. It didn't make it any shinier or any more matte, which is key and rare, very rare. So I don't know what secret sauce you guys were in the lab, mixing up, but I think that was really great. And also, it wasn't watery. So it's a serum, but it stayed on the lip. So can you give me an idea? I don't know what compounds are in here, but how does it stay on giving so much slip without being oily?
So to answer your question, there's many components that make it really penetrate well and not sit in a slippery way on the lip.
Okay.
I wanted to create something that mimics what I do in office, and I have my favorite ways to inject the lip with my favorite products that are just the right consistency, and so it was essential to make this very same kind of consistency. Number one, it's anhydrous. There's no water.
Okay.
There's
no water.
No water. Number two, this has acetohexapeptide 38, which is a peptide that prevents your own fat breakdown, prevents lipolysis.
Wow.
As we age, like I said, we lose fat in the lip. It's one of the essential components to why the lip gets thinner, because it's abundant with fat. And this prevents, this peptide prevents fat breakdown and helps to preserve your own fat. So it penetrates just right.
Okay.
And it's very consistent to what we use in the office.
This is like the antioxidative stress for the lip, right?
That's a great way to think about it, yes.
Okay. So I could smoke if I wanted to. No, I'm joking. I'm joking. I can't. Okay. And so do you take into consideration, is it me as a makeup artist that's thinking also about the post film that actually doesn't change the texture of lipstick or lip gloss? Was that a thing?
Oh, for sure. All our products are designed to be used under makeup, and these things layer beautifully.
They really do.
We hear it all day long. It was an essential component of creating things that will layer perfectly under there. Yeah. I'm thinking the right way. Yeah, so these things layer perfectly. It was an essential component of what we created. And I'm fortunate to be able to work with world's experts just like yourself and what you do. And we, like you said, we take care of all the same people. We, they're coming to me a week before to get ready, months before you're ready, and they're coming to you the day of. And so we're doing the same types of things. And so we had to work hand in hand. And I want this to work perfectly with their makeup regimen. And we've been very successful at that.
So I know you're not supposed to have favorite kids, right? No one likes to say stuff like this, but this is one of my favorites. This is the eye cream, and then I love the plasma. Is it plasma?
Yeah, plasma.
Plasma was a game changer. I knew everything after that. You were gonna blow out of the water. One thing I do want to give you props and say, bro, is that this is a really different collection than most. So like I'm well into skincare. I'm creative director for L'Oreal Paris for over a decade, Medicube's global creative director, and I see all of these different brands from Harlem to Hong Kong. But this is completely in a novel direction. But I don't know if you were trying to do this, but were you just trying to beat to your own drum for what's happening in the office?
Again, doing what I do, surgeries at the highest level, non-surgical treatments at the highest level for 25 years, seeing every single problem a face can present to me with. There's nothing I haven't seen. And there's nothing I haven't figured out a way to address. So I basically wanted to come up with something that is a solution to problems that don't have good answers. That's basically what I'm doing. I'm just thinking about what the problems are, what the solutions are, and I've got the surgical, I've got the non-surgical solutions to everything. And so in my products and in Dr. Diamond's medicine, we just want to come up with the best solutions to problems that don't have good answers.
Wow.
And so look, I'd just like to say again, it's an honor and a pleasure for me to have you here. It's awesome for me, and I'm really proud to have colleagues like you, like the top of the field in what you do. And so my job, one of my main things that I'm thinking of is since we share like all the same types of people, my job is to like basically create something or give them something that when they get to you, it's like the perfect canvas for you.
Okay.
And then you can just, kill it for them to like bring it to perfection,
But as a doctor, you are Van Gogh. I will say.
Oh, I
will say.
I appreciate it.
Bring it in.
I appreciate it.